Hello, everyone. I'm Jason Tokarski.
And I'm Megan McGurman. Welcome to For the Love of Health, brought to you by Christiana Care.
The concept of well-being in healthcare doesn't just impact doctors and nurses. It impacts neighbors and patients and everyone else in our communities as well.
Christiana Care's Chief Wellbeing Officer, Dr. Maureen Leffler, is joining us today to flesh out the concept of well-being and how it impacts everyone. Mo, thank you so much for being here today.
Thank you for having me.
About 2 years ago, we had Katie Godfrey on the podcast, who's the director for the Center of Work-Life Wellbeing. At that point, we talked to Katie about well-being in the sense of COVID-19 and how much the pandemic really sparked that conversation about well-being and wellness in the healthcare space. We're now 2 years removed from that. So much has changed in the world. So much has changed in healthcare. Where does that conversation about wellness in healthcare stand today?
The pandemic was really a watershed moment for well-being in healthcare. It brought to the fore an issue that is decades old, gave national publicity to the challenges healthcare workers face, and it sparked incredibly meaningful changes for the importance of mental health and tending to emotional distress for healthcare workers. The things that started in earnest during the pandemic have really flourished into changes in healthcare that I think are critically important. The pandemic catalyzed changes that really helped to reduce stigma around help seeking, to make policy changes around how we talk about mental health care, and made it safe for clinicians, clinical care folks, to seek support for mental health challenges. That happened in meaningful ways across the country, and it happened in really meaningful ways here at Christiana Care. We have seen a broadening of efforts to address healthcare worker well-being, to be more inclusive of things happening in the actual workplace. A focus on burden of work, administrative tasks, things that are distracting, things that take people away from the most meaningful and important work, which is taking care of our patients. We've also seen a broadening of how we work in healthcare to create a culture of well-being, a culture that prioritizes caring for yourself and caring for other people. We do this through leadership training. We do this through working on creating a culture of belonging. We do this by embedding in our system outreach to support emotional distress when predictably hard things happen in healthcare. We know that hard and sad, bad things happen, but we have not historically made it a priority to take care of healthcare workers when those things happen. So those are broad strokes, how we are starting to approach well-being, I think, more broadly and a little bit differently across the globe, really.
Work-life well-being is something that certainly affects the caregivers at Christiana Care, but really it does also affect the patients and the neighbors as well. Can you go into a little bit of how that is and why they should care about this?
When we have high levels of burnout among healthcare workers, which is the most common kind of occupational distress, we know that that is associated with poor outcomes for our patients. I consider burnout or the lack of workplace well-being to be a public health crisis. I think it's essential for not just our people who work here to thrive, but to take the best care of patients that we can. We really need to have a well workforce. There's a lot of data and evidence over the past decade plus that has really proven that burnout, the most common studied type of occupational distress, is associated with medical errors, poor communication, decreased patient satisfaction. These are all things that really impact us as healthcare consumers.
Mo, you mentioned burnout. I think that's one of those hot words right now that people use in a lot of different contexts. But in your professional and medical opinion, what is burnout?
So burnout is defined by the World Health Organization as an occupational distress syndrome or an occupational injury. That means it's the result of something that people experience in their workplace, the interaction of a person and something in their job. A good example or an analogy is a needle stick injury. That is an occupational injury. So burnout is an occupational injury. A quote from Chris Sinski, who was formerly with the American Medical Association, that I love is, burnout manifests in the individual, but it originates in the system, which really does help to illustrate that this is something related to the work that we do. Burnout is not a reflection of personal deficits, or a lack of resilience. It has to do with something happening to people in their workplace. It manifests in individuals. That part's important too, because burnout shows up as a decreased sense of self-efficacy, which means you just don't think you're doing that great of a job. It shows up as emotional exhaustion, and it shows up as cynicism or depersonalization. As a patient, you do not really want to be cared for by somebody who is cynical or depersonalizing you as a patient or has some level of exhaustion, emotional exhaustion. Hard to bridge that compassionate care if your cup's empty.
Let's focus on some of the actual work that you're doing with work-life well-being to make these programs work. Give us some of those actual hard examples of standout programs that are working to help alleviate some of that level of burnout.
We've established that burnout arises from the interaction of folks at work. It's often the response to ongoing, unchecked stress or a chronic imbalance of the things that you're asked to do, things that you have to do, and the resources you have to do them, usually time. So one of the ways that we're trying to work is by giving our caregivers a tool to identify the things that get in their way of doing their job. We can call these job hindrances. That's a big fancy word for things that just get in the way. Pebbles in our shoes. Based on some national work that's been done called GROSS, Get Rid of Stupid Stuff, we developed a tool here called GROW, Get Rid of Waste. We thought that was a little kinder because we know that the things that we are asked to do all of the time usually have come from well-intentioned places. There was a reason we've had to start doing a lot of the things that we do. But at this point, the work burden on our healthcare workers is a lot. It makes it very, very difficult to prioritize the most important things. For example, a lot of administrative tasks take us away from sitting and talking to our patients, sitting and making eye contact with patients, really being able to listen to our patients. So we're doing work here at Christiana to get rid of the pebbles in the shoes, to get rid of the things that are hindrances or get in the way of those connections that really matter. And we're not doing this alone. This is happening across the organization. There are a lot of really good examples of work being done to make it easier to provide the kind of care that we all want to give and that we all want to receive. So GROW is a tool for our caregivers to identify in the moment the hindrances or the pebbles in their shoes, to share that information with a local GROW champion, somebody on their team, somebody that sits with them, somebody that knows the workflow, and for them to come up with a solution. What can be changed? What can be done differently to not waste time, to not waste effort, to not waste resources so that we can care for our patients. That's one initiative that we're really excited about to support our overall approach to well-being, which is decrease work burden, create a culture of well-being, and make sure people have the time and space to take care of themselves, which is really our conceptual framework for approaching work-life well-being at Christiana Care. Another program that I'm really excited that we've had the opportunity to launch is our Wellbeing Integrated Network, which stands for WIN. The idea is to train and support 12 clinicians across the organization to serve as extensions of our center in their own workspace. So we have 6 APCs and 6 physicians serving as well-being leads for their teams. And we hope that what they'll do is bring resources that exist at Christiana Care to their teams, understand the specific well-being needs of their teams, understand the specific drivers of burnout for their teams, and work with their leaders, with our support, to try things to improve the day-to-day work-life experiences of the people on their teams to promote well-being for their team. One of the programs that I think really stands out at Christiana Care is the Care for the Caregiver program, which is our peer support program. Care for the Caregiver stands out as an intervention because it is specifically directed at creating a culture of well-being. What this means is it's developed specifically to meet caregivers where they are when distressing things happen at work. We recognize that in healthcare, sad things happen, and it can be really hard. And we have an obligation to take care of our caregivers as they're taking care of other people. So peer support is a great tool to do that. People can request peer support for themselves. They can refer their colleagues to peer support. We have embedded referrals to peer support in our event reporting system. What this means is if something goes poorly if there is a problem, if there's a bad outcome, an unexpected outcome, when you're reporting that, you can also refer to peer support, acknowledging that these types of outcomes, which can be really challenging for our patients, are also really challenging for our caregivers. We're committed to caring for our caregivers as much as we're committed to caring for our patients.
You've been with Christiana Care for almost exactly a year at this point. And so you've already, though, I'm sure, seen quite a bit of the success stories that have come from this. How do you know? How do you measure success? What is your sign that these programs are working?
We have seen over the years that we've been measuring burnout at Christiana Care a trending down of burnout among our physicians. That is terrific. That is some indication that the consistent, dedicated attention to this issue may be making a difference in that domain. The other sign that we're succeeding here at Christiana has been the uptake of initiatives all around the system to do things that decrease work burden, decrease work stress, and support our caregivers with measurable impact. For example, using ambient technology to do documentation. This helps efficiency, it may help access, it may help the quality of documentation, but it has been a game changer for our caregivers. There are anecdotes where caregivers say, I still work here because I have the opportunity to use this technology. Providing support for inbox messages, game changer for some of our clinicians. And this was done, again, for patient experience, for quality, for safety. But when we put those measures into place, it takes some of the work burden off of our, in this case, primary care physicians, which makes them feel valued. It gives them the time to do the work that they're really trained to do. It gives them time for their patients. It improves meaning in their work. So those are just a couple initiatives that are not coming from our center, but demonstrate that Christiana Care is committed to figuring out ways to improve work-life well-being.
You mentioned patient experience that draws right back to Jason's question earlier about why the patients and community members we serve should care about this. At the end of the day, this is benefiting everyone.
Yes. Healthcare worker well-being is a quality and safety issue. What that means is that to get the best quality care, to get care that is free of mistakes and errors, the people taking care of you need to be well. They need to be non-distracted, rested, not being pulled in multiple directions, not overly taxed or stressed, not having things get in the way of them being able to sit, think clearly, and make good decisions with you.
There's been external recognition as well. Your team has won the Joy in Medicine recognition from the American Medical Association. Tell us what that means.
The Joy in Medicine recognition is a really cool program put together by the AMA, the American Medical Association. Essentially, it's a roadmap that was created by experts based on evidence and consensus about how well-being efforts should evolve over time. I think Christiana Care receiving this recognition multiple times speaks volumes about the fact that we're on the right path. And I think Christiana Care has been a major contributor to creating the path. I think we've been leaders in how well-being efforts should and could evolve. And I'm personally really excited to see what the platinum level looks like. What's the next horizon for well-being work?
What do you think is the next horizon? Where do you think this continues to go?
What we are aiming to do is have well-being integrated into basically everything else that's happening in a health system. This is work that is shared between everybody. I think we are learning a lot about how different things that our caregivers do and experience impacts them personally. And I think we're learning a lot about what we can do to set our caregivers up for success, to provide the best care. I think as we continue to learn and share responsibility for this work, hold ourselves accountable to it and measure it and see the impact of supporting our workforce on other outcomes that we really care desperately about, like patient experience, patient safety, quality of care, and our financial bottom line. When we hold ourselves accountable to the well-being of our workforce with the same rigor, I think that is really when we'll know we've succeeded.
Mo, thank you so much for your time today.
Thank you both.
Check out the show notes for this episode for more information on Christiana Care's Center for Work-Life Wellbeing.
You can also keep up with For the Love of Health on your favorite social media platform. Just search for Christiana Care.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us.
For the love of health.